Tobago updates. Na, 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 na. Good morning, Tobago. Na, 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 na. Let's go. It's a brand new morning. Rise up to a brand new dawning. As the passion.
Welcome back to Good Morning Tobago on Tobago Updates. Viewers, we are switching our conversation now to something very important that we need to do. Perhaps our citizenry duty, maybe? But I mean, of course, the professionals will tell me a little bit more. But we're talking about donated blood and the importance of donating blood. And we are being joined this morning by registered and certified nurse for the blood bank at the THRA, Miss Gabrielle Phillips-John, as well as Dr. Rhea, Marcano, general practitioner at THRA. So good morning and welcome to you both.
Good morning, Ms. Jackson. Good morning, viewers. Good morning.
All right, so donating blood saves lives. Tell me a bit about, why we need to be donating blood on a very regular basis.
All right, so good morning, everyone. It's important to donate blood. The reason why is blood saves lives. And unfortunately, our reserves are not very high. The World Health Organization recommends that we have at least 70,000 units per year. Presently, Trinidad and Tobago is only doing 20,000 units.
Wow.
Right? And there are plenty of persons in our society who need blood for life-saving measures, surgeries. We previously had a system where you would come in, donate for a family member, and that person would get the unit. But that does not build our reserves. So the initiative we're trying to push is to build the reserves that we have so that blood can be accessible to everybody.
And you see, so a lot of people think that, you donate blood once and that's it. But the blood actually has a shelf life.
Right.
Yes, it does. It is viable for 32 days after donation in the fridge. So that's why we encourage donors to donate. Females can donate every 4 months and males can donate every 3 months. So it will maintain the reserve.
And why is that?
Because we constantly use blood and we always need blood in the blood bank. So that's why we encourage donors to donate.
And also in terms of, the frequency that males and females can donate blood, what's the science behind that?
Well, you need time to build back the blood cells. So that's why you encourage that time. Well, females would have a longer time because the females every month, you have your cycle. Male don't have. So that's why the males can donate more often than the females. Yeah.
And what's the state of the blood bank right now in Tobago?
Well, we are not at a good place in terms of blood collection. So this is why we are having the drive now, which would be on a monthly basis to encourage donors to come out and donate. Yeah.
So what we're actually looking to do is have a base of at least 20,000 volunteer donors. And that now means that we have a person who can donate blood at least 2 to 3 times a year, which gets us up to our 70,000 units for the entire year, which is the recommendation. Having voluntary donors also means that when the blood needs to be turned over, that we know we have people scheduled to come in to replace the units that we no longer can use or that were utilized. So that's why we initiating the drives to make sure and build our voluntary bases.
Now, who can donate blood?
Anyone can donate blood once you are between the ages of 17 with parental consent, and there's no upper limit. So you can donate blood at any age once you are healthy. When you come in for a screen, we can determine that because we have nurses and doctors will be at the blood bank to screen you, and then we'll know if you are eligible or not. So anyone can donate.
Additionally to that, online on the Ministry of Health website, you can actually go and do a pre-screening. So it will let you know if you are eligible to donate. So you don't need to come into us to find out if you can donate. You can actually do this from the comfort of your home, sitting down on your laptop, looking at television. You could just type in your information, answer a couple of questions, and it will guide you as to whether or not you're eligible to donate blood.
Now, when you're thinking about donating blood, you think about needles. And I know needles is something that a lot of people are afraid of. Me for one. So, in full disclosure. But, walk us through that whole process and walk us through, how do you handle people that may be a bit apprehensive about those long needles and, tell us how easy the process is, that sort of thing.
Okay, so when you come to the blood bank, you can either walk in or you can make an interview, as Doc say, online. And you would be interviewed. There's an interview before you'll be interviewed, and we have a pre-screening where we do your vitals, blood pressure, temperature, weight, height. Once you pass the questionnaire, of course, you'll have to sign your consent form, giving permission. You'll be taken into the unit where you'll be made very comfortable on the bed/recliner. The area is sterile. And we'll be collecting, it doesn't take long, like 4 to 7 minutes on bleeding. Yes, the needle is very big. It has to be big to enhance flow of the blood, or else we'll be there all day. However, the nurses at the blood bank, THRA, are very efficient, and we are good at making people comfortable. So, yeah, no fear. Just come on down.
I mean, and I can vouch, yeah, because like I said, I'm somebody with very small veins and stuff like that. And I mean, and let's talk about that too, because yes, so somebody like me who has these very tiny veins that are sometimes very difficult to find.
Yeah.
How easy it is for you all to find it, as opposed to,
It's easy because we are professionals at this. We have been doing this for many years. People just always come in the first thing because they're afraid. I have very small veins. And you just look at the patient on assessment. Okay, those veins are lovely for us. Yes.
Listen,
so yeah.
I've never been able to understand this philosophy about what is good veins.
Well, they are. Once we can feel it, once we can see it, they are good enough for us.
But I really do like the way how you describe it, lovely veins.
Yes, lovely veins.
Yeah, and I mean, so what's been also some of the experiences that you've had with people that have come out to donate blood, people that might have been a little apprehensive at first?
Well, they would sit in the waiting room, and first of all, 5 minutes is too long for them. So, we have to try to rush the process. When they get into the unit and you explain to them what the process is like, they go through, it's like, well, this is what I was behaving so for. So you just, just going through education, teaching is very important when it comes to blood donation. So after the patients, they become comfortable and they're willing to donate. Some even come back. They came to donate for someone, and they become voluntary donors. Voluntary, VNRBD, voluntary non-remunerated blood donors, meaning they donate for everyone and anyone. There's no name to it. It's just they come to save lives.
And out of males and females, who donates more?
Males do donate more. Yeah, on a monthly basis, you'll get more males than females.
Even though they sometimes are a bit more afraid of needles than women.
Yes. The men are really afraid of needles and blood, but they do come out to donate. Yeah.
And then after, if a fella comes in and he's like, not liking those long needles and stuff like that, what's usually their reaction afterwards?
Some are very ashamed after they complete the process, knowing that they were afraid of this small needle. Yes, it's a small needle. That's what they say. This is a small needle. This is how I was behaving. So they become very comfortable after they went through the shame process. Yeah.
Now, is there anything else that the public needs to know about donating blood? Just things that they need to be aware before they come into the clinic?
Yes. So before anyone comes to donate blood, you must have a meal. You must hydrate. So on the 28th, which is Wednesday, at number 5 Montessori Drive in Glen Road, the THRA will be having a blood drive. And we encourage persons to hydrate before. So starting today, tomorrow, you could have lots of water, juices, tea, no alcohol. You must have a form of ID, walk with a form of ID, and you must be well rested. And then we'll take it from there. Some persons, if you wish, you could go and make an appointment online on the Ministry of Health. So when you come, we know, we also accept the walk-in, but when we come, we know that you're already set for a date.
Right.
Yeah.
And then can you go back to work afterwards?
Yes, you can. You can function normal. We encourage the donors to listen to the post-op care. So after you can work, some persons we don't allow them to go back to work because you have to avoid strenuous activities, exercises, cardio exercises, lifting of heavy objects. So yeah.
And it's usually just for that day.
Just for that, just what 24 hours. 24 hours, yeah.
All right. Is there anything else that we left out, Dr.
Marcano?
Yes.
No, we didn't leave out anything, but there's a couple of things I'd like to mention. When you come in to donate blood, we usually would screen you. So that screening process will look at diseases that can transmit from one person to another, and it works in double benefit. You get a free screening, yeah, and it also ensures that the blood that we give to society is safe. So I think that's a very important point because a lot of persons are concerned whether they can contract these diseases or not from blood.
Another thing, the public would always make excuses that, I'm diabetic or I'm hypertensive, but diabetics and hypertensive can donate. So that is why we have the pre-screening, and, some medications won't allow you to donate, but you just come into the blood bank and we will sort it all out so you will know if you are able to give or not.
And what about people who might use, let's say, herbs?
Herbs, no problem. You come on down. People also who have tattoos. So people always say, I have a tattoo and I can't donate. Yes, you can donate with a tattoo, but it depends on the time frame. So it doesn't hinder you from donating blood.
All right.
Yeah.
So there you have it, folks. Come on down, because of course it's more than just doing civic duties, making sure that we can save lives there at the hospital.
Yes, because 1 unit save 3 lives. 1 unit. So your unit can save 3 persons' lives. So we are encouraging donors, please come down to the blood drive on Wednesday, beginning at 8:30. We are there from 8:30 to 3 o'clock.
Yes. All right. So folks, there you have the information. Get out there and donate some blood. It's really not as scary as it seems. And the great thing is that we have some wonderful nurses that will be there and would help you through the process. And I'm saying this from experience. So, and my experience was documented live. I'm not too sure how that was organized or how you all got me to do that, but yes, so it's actually a lot easier than it sounds, and it's less scarier.
Yes,
but
right.
I know.
It's a quick process from interview to bleeding. More the interview would take some time, but bleeding, getting the unit where we collect the 500 mils of blood, 1 bag, it's between 4 to 7 minutes. Yeah.
All right. Okay. Sorry.
One last comment. She mentioned that a unit is about 500 mils of blood. It only takes you a couple hours to gain back that 500 mils that you've given to us, and for persons who like, Doc, you're taking all my blood. No, you have about 5,000 mils inside of there, so you'll be fine, right? So just encourage people that it's not as scary as you think it is. It isn't detrimental, and it's something that is life-saving. So come out and support.
Yes.
All right, great. And thank you both for being on with us.
You're welcome.
And viewers, go out and donate some blood. We'll see you right after this break.